I did some research and gathered all the popular post-Botox recommendations that practitioners give to patients. In this video, I will clearly explain which of these are facts and which are myths that need to be debunked right here and now. In this video, I will present to you the most common post-Botox recommendations. I'll tell you which of them make sense and which are just myths. I'll explain why it's worth following each of these recommendations or not. Recommendation number 1. After the procedure, you shouldn't move your forehead muscles or make facial expressions. This is a popular recommendation because many people are afraid that the Botox will migrate, meaning it will move from its original place. But what's the truth? This might surprise you, but it's actually the opposite. Moving, working your forehead, or using other muscles treated with Botox after the procedure can actually speed up the effects of the treatment. It's a well-known fact that botulinum toxin doesn't produce immediate results, and you have to wait a few days to see the first effects. The full effects of the treatment appear after 2 weeks. And now pay attention. Moving your forehead muscles after a Botox treatment on the forehead speeds up when the first effects appear. And I have research to back this up. In this study, 22 adult women with forehead wrinkles participated, all of whom underwent a botulinum toxin treatment. Half of them were asked to perform facial muscle exercises for 4 hours after the injections, while the other half did not do any exercises. The exercises involved raising the forehead and frowning in 3 sets of 40 repetitions, with 10-minute breaks between each set. 6 months later, after the effects of the Botox had worn off, the participants underwent the procedure again, but this time the roles were reversed. The women who had previously done the exercises were instructed to avoid them, while those who had not exercised before were now told to perform them. Both the scientists and the participants themselves assessed that the Botox started working faster when the patients performed facial exercises after the injection. On average, it was 1 day faster, so only a little faster but still noticeable. After 2 weeks, there were no longer any differences in the effectiveness of the procedure between the two groups. No differences were observed in how long the effects of Botox lasted before wearing off. Why does this happen? Botox binds to receptors on nerve cells to relax the muscles. The authors suggest that it is possible that exercises speed up this binding process. Recommendation number 2. After Botox, you can't bend over. This is probably the most common recommendation after Botox, and it's very troublesome for patients. It's troublesome because often this restriction on bending over lasts for 4 or even 6 hours after the procedure. What's more, it also means that the patient can't lie down after the procedure out of fear that the toxin might move within the body. I've even had a few situations in my office where a patient would schedule an appointment, but she insisted on the latest time being 5 o'clock because at 11 p.m. she wanted to be able to safely go to bed since she had to get up early for work the next day. And now to the point. Is this restriction a fact or a myth? To everyone who avoided bending over after their Botox treatment, I answer unequivocally, this is a myth, and I have 2 simple explanations for it. First of all, if you're worried that the toxin will move if you lower your head or lie down, this can easily be debunked with common sense. Because if the toxin, after being injected into the muscles, were to move around the body, that is migrate, it would migrate downward. So actually, when the patient keeps their head upright and is standing after the procedure, the toxin would, due to gravity, travel downward and, for example, paralyze the eyelids or even the smile. Sounds logical, right? And now, if that same patient, for a change, were to lie down on a massage table, then the toxin wouldn't migrate up or down because gravity wouldn't be able to move it that way. What I'm getting at is that if Botox migrated so easily after being injected into the muscles, then having the patient upright would probably be the worst position of all, not the best, as the recommendation would suggest. Alright, now it's time for a more scientific explanation. When a doctor injects Botox into a muscle, the toxin starts working in the synaptic vesicles immediately, and the entire process of muscle paralysis literally takes just a few minutes. So by the time you've paid for your appointment, everything that was supposed to happen has already happened. It's true that you'll only see the effects in the mirror after a few days, but Botox does its job immediately, just moments after it's administered. Exactly. So since Botox works so quickly, does that mean you can literally do anything after the procedure? Not necessarily. And that's what the next recommendation is about. Recommendation number 3. You can't drink alcohol after getting Botox. If you've ever been to my office for a procedure, I'm sure you've heard this from me. That's because this recommendation is true, and you must not drink alcohol after Botox. However, I won't leave you with just that dry piece of information. Let's take a step deeper and see why doctors recommend abstaining from alcohol. What could happen if you drank alcohol after the procedure, and how long should you avoid drinking after the treatment? I'll first answer the question of what would happen if you drank alcohol after the procedure, for example, on the day of the treatment. The only correct answer is that there are no studies on this topic, but I expect that probably nothing would happen, and the effect on your face would be the same as if you hadn't drunk. However, there are a few big buts here. First of all, the word probably coming from me is because there are no scientific studies that clearly inform us about the effects of the procedure after consuming alcohol. There are no such studies because no scientist has decided to investigate this, so the observations of a single person like myself, for example, are not sufficient to confirm or refute this thesis. Secondly, effects aren't everything, because even if the toxin worked on the muscles as it is supposed to after consuming alcohol, various unpredictable reactions could occur in the body. For example, there could be increased swelling, longer healing after the procedure, and an intensification of other side effects of Botox that may occur, such as flu-like symptoms after the treatment. Thirdly, alcohol consumption means something different for everyone. For one person, it might literally be a glass of wine, while for others, it's going out to a party, partying until morning, and consuming extreme amounts. The more alcohol you drink on the day of the procedure, the greater the risk that something will go wrong. To sum up, on the day of the procedure, it's better to stick to this recommendation and not drink any alcohol at all. The next day, it's already allowed. Botulinum toxin is a medication, and that's how it should be treated. Recommendation number 4. Do not apply makeup after the procedure. This point will be brief, and the recommendation that you can't use makeup is a myth. However, I understand why it is often given to patients. Generally speaking, you can apply makeup immediately after the procedure and it will not affect the results or possible complications. With one condition. Applying makeup after the procedure, generally speaking, often saves the day for patients who need to return to work or have an important meeting and don't want visible redness on their skin. Makeup itself is neither harmful nor dangerous. What could be dangerous and what I want to emphasize is the lack of hygiene, that is, using cosmetics or applicators that have not been disinfected. However, if after the procedure you use new cosmetics and apply them with your own clean, washed hands, not with a previously used brush or sponge, then there is no risk here. In general, after a botulinum toxin procedure, the marks on the skin are very minimal and are limited to slight redness. However, for your own convenience, it's good to know that makeup is possible and allowed, and using it will not affect the results of the Botox. Recommendation number 5. Irregularities and asymmetries after Botox can happen. This is not a typical post-procedure recommendation, but I regret that so few patients are informed about this right after the treatment. I think that knowing this could help them avoid a lot of unnecessary stress. The point is, if a few days after the procedure you see a result, but it's uneven or not quite what you wanted, there's really nothing to worry about yet. The most important sentence to remember from this video is that Botox works in a non-linear way. This means that when the effects are just beginning in one area, it might temporarily work more strongly and in another, less so. And that's completely normal. However, I do understand that from the patient's perspective, there can be extra stress if, for example, a week after the procedure something isn't quite as it should be. Remember that botulinum toxin shows its full effects 14 days after administration. Full effects also mean even effects. Only after 14 days can we be sure that in every injection point, the Botox has worked exactly as the doctor intended. Recommendation number 6. Do not massage the areas where the injections were made because you might move the Botox. This recommendation is often encountered, as mentioned by my first-time patients who have previously had this procedure done in another clinic. But you'll be surprised when I tell you that in some clinics you can actually encounter the exact opposite recommendation. That is, patients are advised to massage the areas where the toxin was injected. So what is the truth? What is a myth and what is a fact? In reality, neither one nor the other is entirely correct. But let's start from the beginning. Right after the procedure, you'll have small raised bumps at the injection sites on your forehead. That's because a liquid containing botulinum toxin was injected there, which caused a temporary swelling in the tissues. From the second point in this video, you already know that botulinum toxin starts working very quickly, much faster than many patients or practitioners might think. So does that mean you need to be careful with massaging so you don't move the Botox around? My answer? Yes, it's better not to massage those bumps and just leave them alone. However, this isn't because of the risk of the product migrating, but rather to maintain proper hygiene. And on the other hand, what about people who are told to massage the injection sites so that the botulinum toxin works better? According to the authors of this scientific article, there is no evidence that massaging the treated area provides any additional benefits. So since the benefits of massaging are unknown and the risk of compromising antiseptic conditions increases when we massage, we can clearly debunk this post-procedure recommendation. 7th recommendation. Do not use the sauna or tanning bed for 3 days after the procedure. This will be a short point because there is no need to cite scientific studies to justify its validity. Public facilities such as tanning salons, saunas, or swimming pools do not promote skin healing after the procedure, and I strongly advise against using them for the first 3 days following the treatment. Firstly, because the punctures may heal more slowly and there is a risk of infection entering the body. Secondly, because heating the tissues after the procedure can lead to unexpected symptoms, such as swelling at the puncture sites. This recommendation is a precautionary measure. And it's not that if you accidentally forget and go to the pool in the evening on the day of your Botox treatment, the results will be worse, but it's simply not worth risking the consequences and stress on your part if your body reacts in an unexpected way. 8th recommendation. Avoid exercise on the day of the procedure. It's the same with the next recommendation. 8th recommendation. Avoid exercise on the day of the procedure. This recommendation is absolutely justified for similar reasons as the previous one. I specifically tell my patients after the procedure to avoid intense physical activity on the day of the treatment. How do I understand intense physical activity? Generally speaking, any activities where you would break a sweat are not recommended on the day of the procedure. So running, gym workouts, CrossFit and swimming are out. You can go for a walk, ride a bike calmly, for example to work, go shopping, and function normally. However, I do not recommend any strenuous activity on the day of the procedure because sweating and exposing your body to additional physical stress does not promote tissue healing. And yes, I know we're only talking about a few injections here, but in addition to that, a medication, a neuromodulator, was administered to your body. Something has happened, and for that reason, it's better to take it easy. However, just like in the previous point, if you forget and end up running to catch the bus and get a bit out of breath, nothing will happen, neither to the results nor to you. Here, a common question comes up about what to do when it's July, it's 35 degrees outside, and sweating is inevitable. Does this have any effect on the procedure? No, it does not. Aesthetic medicine procedures are performed in all parts of the world, including, for example, Los Angeles or Saudi Arabia, where it's always sunny and warm, and the procedures are successful there as well. 9th recommendation, do not fly by plane on the day of the procedure. To answer whether this recommendation is justified, I have a story from my own life. I was flying abroad for the weekend, and since I work a lot in my office, on the day of my departure I worked until early afternoon. However, since both I and Dr. Andrea, who works with me in the office, finished our work a bit earlier, we had a few free minutes to spare. And what do 2 aesthetic medicine doctors do when they're bored? Of course, Botox. So Dr. Andrea gave me Botox for my frown lines, the corners of my mouth and the muscles in my neck, which is my standard package. I remember that I was still sitting in the medical chair when I ordered a taxi to the airport so I wouldn't be late. Of course, not long after I was on the plane, the flight went smoothly and nothing happened to me. Everything was great, including the results. So, does that mean you can't fly on the day of the procedure? You absolutely can, without any problem. This myth about not flying comes from the idea that the supposed difference in pressure could move the Botox, which is absolutely not true, as you surely know by now. Since I often have patients from outside Krakow who head straight to the airport after their visit to return home, I am absolutely certain that flying is not an obstacle to the success of aesthetic procedures. 10th recommendation. Botox stays in the body forever and reaches the brain. I admit, this isn't a typical post-procedure recommendation, but rather an opinion that you can very often find on the internet. Because if we get Botox every few months, for example over 20 years, then the toxin accumulates in the body, right? Exactly. I've recorded a very detailed video in which I describe, step by step, what happens to botulinum toxin from the moment it's administered to the body, all the way to the very end. This is important knowledge to have in mind before you undergo the procedure yourself. So go ahead and click on the video thumbnail that's now appearing on your screen to satisfy your curiosity. Thank you for today's video and see you in the next one.